Over the last 24 hours, we have identified 240 new cases of COVID-19 and completed about 5,500 tests. Our positivity rate is 4.3%. There are currently active alerts or outbreaks in 129 schools. 8 of these schools have had 10 or more cases infectious in the school in the last 14 days. There are currently 373 people being treated for COVID-19 in hospital, including 76 in the ICU. Sadly, 5 new deaths have been reported to Alberta Health over the last 24 hours. I extend my condolences to those who are grieving the loss of these Albertans and any others. Each death continues to be a sad reminder of the kind of impact this virus can have, and why our collective efforts against it matter so much. The total Omicron case count for Alberta remains at 11. Given our current aggressive testing program, it is likely we will continue to detect more cases and respond to them as we have to date. I would also like to speak to some information I shared on social media on Monday, where some household members of these cases have tested positive for COVID but have not yet been confirmed as Omicron. I would like to confirm that both schools where there was a potential exposure have notified any possibly exposed groups. Anyone who has received a notification letter is asked to go for testing and monitor for symptoms. I know that some Albertans have asked why close contacts are not being legally required to quarantine at this time. Close contacts of suspected or confirmed Omicron cases who were not fully immunized are strongly recommended to quarantine at home for 14 days after their last exposure. All close contacts, whether or not they are fully immunized, should also monitor for symptoms, and if they become symptomatic, they must stay home and arrange for testing. Of the 11 cases that have been identified in Alberta to date, 7 of them were in fully vaccinated individuals, 2 were in partially vaccinated individuals, and 2 were in unvaccinated individuals. Again, it's important to remember that we have seen some breakthrough infections with all variants in the past. And so we do know that from the information that we're seeing, again, in places where they've had more Omicron cases, that there does seem to be a protective effect of vaccine against severe outcomes from this early information. And vaccine does remain a very important measure against Omicron, even if there is somewhat of an escape from infection, as we saw with Delta. We anticipate that the severe infection or the severe outcome prevention will remain a very important part of our community's protection against the Omicron variant. I would like to remind Albertans that the Omicron variant is a variant of COVID-19. It is not a new disease. While we are still learning about the Omicron variant's transmissibility and severity, this is not the first time a variant of concern has emerged in Alberta, and it will not be the last. We will not stop transmission. Our goal is to slow initial spread to give us more time to learn about the variant. We already have many tools at our disposal to limit the spread of COVID-19 and its variants and protect ourselves from becoming severely ill. I understand we've been hearing that frustration certainly since we implemented the measures, and that concern about being able to have gatherings with many people in those formal settings, whereas in a home setting having much tighter and stricter rules. One of the key differences is the ability to monitor and have a compliance framework in place with respect to making sure that vaccine status is being checked or a recent negative test. I recognize that masking continues to be a challenge, but I guess what I would say is that we know that indoor social gatherings, when we've looked at our data from all of our different waves, it's really clear that gathering together in someone's home in that informal environment is one of the types of activities that has the highest risk of transmission. And we know that our, again, our numbers in our healthcare system, while we've been seeing declines, and that's great, they have slowed. We're sitting at more of a bit of a plateau right now. And so any adjustments that we make to our rules, we need to be taking into account that whole system impact. So I would ask people to hopefully have confidence that we are looking at the options, that we know that restricting social gatherings does have an impact. It has an impact on people's ability to socialize, the sense of isolation, and that those have impacts on health too. So this doesn't go without consideration and attention. It's just that we also know that our acute care system has been under tremendous strain for a very long time, and we need to make sure that any changes that are made to our public health framework is taking into account the possibility of a combination of seasonal gatherings, the impact of seasonal transmission risks, the potential for some waning immunity, which is again why we're rolling out boosters, but that there could really be an impact from all of these things coming together over the next month. And we need to contemplate that as we try to weigh out all of the risks and benefits of changing the rules for gatherings.